Majid, I have to do cooking quickly.
He's a very nice person because he's a caring dad.
Sometimes he's grumpy, and we like that part of him because we laugh about it.
Happy birthday to you. The teachers were telling us about the virus. They said that sometimes it kills people, sometimes some people survive from it.
How long's your dad been in hospital for?
Since March, 2 months and some weeks.
Even in the midst of this incredibly challenging year, young people really have, stepped up in a huge way. Lots of them are taking on caring responsibilities, taking responsibilities around cleaning, around caring for younger siblings, and that's a real change in a dynamic in a family.
I have to try and help my sister study a lot. It's been very hard because they miss my dad too. My littlest sister, she always cries in the night and saying she misses daddy. And then my second sister, she always sleeps with my mum because she's always scared.
In terms of their education, a huge number of young people are still sort of being taken out of classrooms whilst they need to isolate. Because of the way the brain develops, social contact with peers is incredibly important. For young people to suddenly not see their friends is a huge change. The world really turned upside down for a lot of them, and they described feeling incredibly lonely. A lot of them talked about how digital communication it just isn't the same.
Have you been able to see your dad at all in hospital?
No, but we do a video call so we can say hello to him. I feel happy that I get to see him, but then I feel sad because it sometimes makes my mum cry, and then I cry as well.
Kala, we hope you can hear us. Please come back. Please come back.
Most of the time, I mostly think about my dad. But sometimes I have to try and put it out of my mind because it upsets me a lot.
The adolescent age group, secondary school and right up to really early adulthood is really crucial. We've seen a lot of people of all sorts of generations being affected, having their mental health affected.
They said we had a cardiac arrest, and I was really broken from that. I'm really scared. Being 18, I just turned 18 in December. I was expecting 2020 to be like me being 18. This whole time I would have been having the time of my life and having my experiences, but I just have to live this life and see exactly what happens and be strong, because it is a really tough time.
Lots of young people were expressing really deep concerns about whether or not there is going to be a future out there for them. A lot of them were beginning to feel a sense of hopelessness that, what is there for me? Are there going to be jobs? COVID has affected all areas of life, things like lockdown, access to education, cancelling of exams has had a huge impact. So the Health Foundation has been working with young people between 12 and 24, really trying to look at how you can really set them off on a path that means they have a healthy future. So if you can really get young people into a secure, sort of stable foundation, then that will leave them in the best position to be able to thrive throughout the rest of their adulthood.